we have an addition to your fall to-do list. Besides raking leaves and cleaning gutters and pulling out your warmer winter clothes, take time to do a checkup on your health insurance. Why now? Doug Bennett is here to explain. Doug is the Director of Individual Health Plans at Medical Mutual of Ohio. Welcome to the show, Doug.
Hi, Lori. Thanks for having me. Appreciate it.
So who is it that should be taking time to take a look at this particular to-do?
So the particular to-do right now would be start with individuals who are already insured through the Affordable Care Act. It's a good time for a checkup for them to review their insurance needs, as well as really almost anybody else. If you're not eligible for Medicare and if you don't have access, let's say, to insurance through your employer, this is a good time to start shopping and figure out what plans might be right for you and your family.
Okay, so how do we find out what the options are available to us?
So that's a great question. I think a lot of people get intimidated by it, and I think the most important thing we try to communicate is you don't have to go at this alone, right? There's a number of different ways. One of the most popular options, people talk to a licensed health insurance broker. These are folks who specialize in the health insurance market. They can take you through the ins and outs of various plans and rates with different insurance companies, help find what's right for you and your family. Another real good option, just call the insurance company themselves. At Medical Mutual, for example, we've got a staff of licensed agents in a call center. You can call our 800 number, and they can take you through all of our plans and find the right fit. And a third option, of course, is more and more people are choosing to shop on a website. They like to do this on their own, right? And you should be able to, at medmutual.com or with other carriers, enroll, pick your plans all without any intervention if that's the way you choose.
Okay, so as we're comparing these plans, what do we have to keep in mind?
You know, so there's a variety of things to keep in mind. First is cost. Most people are shopping with their wallet. It's an important piece. The real basic rule of thumb is you can choose to pay the higher premiums on a monthly basis, and then if and when you need services, you'll spend a little bit less out of pocket on things like deductibles and copays. What's becoming more popular, individuals are choosing to pay a little bit lower monthly premiums, and then they'll have higher out-of-pocket costs on those deductibles and copays if and when they need to use the services. The other most important thing, and a lot of people, it's not just the benefits. Check the network. Different insurance companies are going to offer a different panel of hospitals and physicians that you can utilize. We want to make sure that people are investigating that their doctors and hospitals are in the network.
Yeah, you want to see your doctor.
That's right, so they don't get a surprise when they need the care.
Right. So what if we like the plan that we're on? Can we just let it sort of roll over at the beginning of the next year?
So it isn't what we recommend for a variety of reasons. First, if you're already insured, there's a good chance, though, that there'll be some changes to your plan, right? The carrier might make some changes. So we think it's a good idea to go out and take a look at what those changes will be, make sure it's still the right fit. The other thing is, if you're getting a subsidy today, some help from the government with your premium, or to find out whether you're eligible for a subsidy, those numbers change year to year.
Okay.
So also a good idea to go tune in and figure out whether or not those are the right fits for you. We're amazed. Literally millions of people are still missing out on subsidy opportunities. You qualify for a subsidy, anybody with an income between 139 and 400% of the federal poverty level. And we find people to be surprised that they qualify based on their income. They're surprised that they qualify for some help and they're missing out on that opportunity.
Wow, why turn away free money, right?
Exactly.
What if we just end up not getting insurance for the coming year?
So you could run into that problem, and where you have to be careful is if you don't meet some of these deadlines that we're going to talk about, you may not be able to get coverage the rest of the year. You're going to have a special qualifying event. They call it something like a birth, getting married, maybe loss of coverage through an employer. The other thing to be concerned with is the tax penalty. The Affordable Care Act requires you to have insurance, and if you don't, you can be subject to an income tax penalty up to 2.5% of your income for the year.
Boy.
Plus you don't have the insurance that you need.
Wow. Okay. So we got some deadlines real quickly.
Yep. The deadlines, most important one, December 15th.
Okay.
Right? By December 15th, you're covered for January 1st. If you miss those dates, you've got two choices. December 31st gets you a February 1st effective date. By January 31st, you get a March 1st effective date.
All right, important dates. So you still have time to make this important decision. So use it to make the best one for you, your family, and your health. If you need help in understanding your health insurance options, use the information that's coming up next. My thanks to Doug Bennett for putting us on his to-do list for today.
Thanks, Laurie.
Find out more about Medical Mutual of Ohio by visiting www.medmutual.com/go or call 1-844-606-5387.